So we've talked a little bit about the what, we talked about the how, but now we got to figure out why. Why is a patient unfortunately developing disease progression despite being on a very selective, a very precise type of medicine, which we call targeted therapy? So this is the why, and it's a really complicated slide, so I'm going to break it down for you. One of the first mechanisms that we think about for resistance that develops on targeted therapy, right? So this is a patient who's on targeted therapy. This is showing you the signaling that's happening, is that these patients unfortunately will develop what we call on-target resistance. On-target resistance means that the cancer cells develop mutations in the same target that the therapy is aimed at. So I'll give you a specific example for our patients with EGFR positive disease. So you may have heard of some of the more classical or common EGFR mutations, like EGFR exon 19 deletion or EGFR L858R mutation. Well, unfortunately, in some patients who are taking targeted therapies such as osimertinib or Tagrisso, for example, they will develop an on-target resistance mechanism. And so an example of one can be the C797S EGFR mutation. It's actually the most common mutation that's acquired upon resistance to Tagrisso or osimertinib. Happens in about 6 to 18% of patients, unfortunately. But when we understand that on-target resistance mechanism, there may be options for therapy that we can aim and try to overcome that resistance. And so that's why it's so important to understand, is there an on-target resistance mechanism? Next, there's a potential for off-target resistance. And so this is what happens when resistance comes about from a change in other pathways that bypass the targeted therapy. And so another example, going back to our patient with EGFR positive disease, they're on their osimertinib, it's targeting that EGFR pathway, but the cancer gets smart and it learns to take a bypass route, a bypass pathway. And so these are some examples of other alterations in cancer that get upregulated and that allow the tumor to escape and sort of grow on that pathway. One of the more common ones in EGFR is called MET amplification. Happens in almost 16 to 18% of patients who are on Tagrisso or osimertinib. But once we learn that, there may be an opportunity like this box in green to really target it. So that's another example of why it's so important to understand. Finally, we have this other potential acquired mechanism of resistance that we call a lineage transformation. Dr. Sen and her lab do a fantastic job of really trying to understand why this is happening. And so what that means is you start off with non-small cell lung cancer, right? The most common type of lung cancer. And then the cells, the biology of the disease actually changes, where you have a switch in the cancer cells and it changes from one type of cancer, non-small cell lung cancer, to potentially small cell lung cancer, which is unfortunately a highly aggressive type of lung cancer. So this is a nice depiction of how that happens. Patient is exposed to the EGFR TKI targeted therapy drug like osimertinib. It's doing a really nice job trying to shut down those pathways that upregulate the growth of these cells. And then unfortunately, there happens to be some genetic changes, a loss in these genes such as RB1 or TP53, and it causes a change in the types of cells that are now causing trouble into small cell lung cancer. And then finally, there's one more sort of bucket that we think about for acquired resistance, and it's the ever unfortunate, really frustrating bucket, and that's called the unknown, where we just don't know yet. Dr. Sen and colleagues in the lab are doing a fantastic job trying to understand it, but these are generally the 4 potential mechanisms of acquired resistance to targeted therapy.